Hello, all. Hello, guys. See, nowadays many people are telling that AI is going to replace doctors. Even Elon Musk told that 95% of doctors would be replaced by AI. Okay, so what I'm going to do is some of the I'll just show you a day in the life, and you can see how many can be replaced by AI, how many cannot be replaced. It's a genuine video where I would tell you that some of the things can be replaced, some of the things cannot be replaced. I'm going to show you some of the things in my life. Okay. And I will try to cover other specialty doctors also so that you get a better understanding about what actually doctors do. Okay. Because many people think that being a doctor is more about uploading a scan. You go to diagnostic center, get a scan report or a film. If you upload that to GPT-5, it will give a recommendation or treatment or whatever. That is being a doctor. Then I think you have to see what are the things we do, and then you can take a call about whether it can be replaced or not. Okay, that will be a good way of understanding. I hope Elon Musk also watches this particular video. Let's see. So now I'm going to show you some of the uh, you know images where you get to know what actually we do. So let me show you. This is one case where we're doing here monitoring. There are some of the waves. So many metrics we assess during our surgeries. Here maybe you can tell that AI can replace. Okay. So I hope you're seeing now. So see this screen if you're seeing. So if a surgery is going on, the top one is the ECG. After that, you have the pulse oximeter and then arterial blood pressure monitoring. You can see this red color one. And below that, we have something called bispectral index where we monitor the brain function during anesthesia. So the thing is, what AI can actually replace is analyzing these particular waves and giving recommendation for us, and saying that the patient is in this plane of anesthesia or that plane of anesthesia. That can be done. But the thing is, to get the arterial trace, you have to insert a catheter finally into the radial artery of the patient, which is very difficult to do, which AI can never do. And placing the sensors for EEG and all that should be done by humans. Okay. And some require high level of expertise, some require a lower level of expertise. So this is one. And next I would show you some more. I will show you some more things you can. Okay. So this is an awake craniotomy where the patient is kept awake, and one side you can see some infusions are going on, and then we are actually talking to the patient when we are operating the patient. Okay, so these kind of cases, we have to be there with the patient, and then what we have to do is we have to keep assessing the patient's motor power during when surgery is going on. So these are the kind of things I don't think AI can replace. But what it can actually do is when the surgery is going on, it can actually analyze the waves which are coming from the hand, and it can also take feedback from us when we are talking to the patient and from our audio or text or whatever, club both and give some recommendations to us. This is what it can do. Okay, I'll show you something else. We'll try to show you something else. Wait. So this is another patient where you can see a lot of wires have been inserted and all that. They're connected to a machine. Okay, it's called neural monitoring machine. So we connect and we get signals from different parts of the body. And this is a way of understanding whether the signals are going very well through the spinal cord or not. So even these kind of things to do, a human is required to understand which muscles to connect, where to connect in a muscle. There are different locations there, and which there's so many slots here. See these slots, you have to connect all the wires there. So, and these are the kind of things I think AI cannot do. Maybe it can help once the wave is generated. Once you go through all this, uh, phases of connecting and getting the waves and going through all the hurdles, then maybe AI can help us in final interpretation and giving recommendations on further treatments. Okay, let me show you something else. Yeah, this is something. This is called as a transcranial Doppler. You can see here where we are actually putting an ultrasound probe there near the brain. And then what we do is, what we get, I'll show you. There is a technical skill required here. That is why I'm trying to show that. So let me show you what actually we get once we keep. So we get to see a lot of blood vessels inside the brain. You're seeing on the screen. So you can see there's the structures which are glowing on the ultrasound screen are the blood vessels inside the brain. So getting this view is not very easy. People who are regularly doing this only will understand how difficult it is, because slightest movement in the probe, which is kept on the brain, would lead to gross errors in the calculation, measurements, and also wrong interpretations and wrong treatments. So with experience only we understand what is the exact correct thing. So getting this view AI can never do, but only thing which it can help is once we get the trace. I'll show you the trace so that you understand better. Yeah. So this is how a trace looks like. So once we get the trace, so we have to go into something called a pulsar Doppler. And once we get the trace, AI can actually help in understanding the shape of the wave. It can actually this is manually done, whatever you're seeing on the screen, the tracing of the wave, but it can be done by AI. It can give interpretations, recommendations, diagnosis, and all that can be done, but it can never get this particular window and view, which needs to be done by a human. And if you tell robot can do it, I don't know. It will be very tough, I think so. I'll show you some more examples. Okay. Yeah. So you can see this. This is, so you can see a small tube which is going into the mouth. This is called endotracheal intubation. And these are the kind of tubes we have to place through which the anesthesia gases would go to the patient. Placing the tube, it's a combination of skill, and also you need gadgets there, and a lot of manual dexterity required. That means a lot of hand movements and all are required. While doing, there is a possibility that you can actually lead to certain complications like fall in the oxygen levels and all that. So we have certain training in that. We follow certain guidelines, and that is plan A, plan B, plan C, and all that. So this inserting the tubes and inserting all these things, inserting the catheters, in that way, inserting the central lines, the lines that we place, which go inside the internal jugular vein, and all those things cannot be done by AI. Maybe what it can do is, once we do that, you can actually see this is the anesthesia machine which is behind me. Here you can get to see some of the waves there, and looking at the waves, maybe AI can tell us what is how the waves are there. And looking at the graphics, it can maybe tell us if the pressures inside the lung are increasing, if there is something called peak pressure, if that is increasing, what are the possible causes? Is there obstruction in the tube, or are there some secretions in the tube, or is it related to the machine, or is it related to the lung of the patient, or is it related to the cardiac condition? There are several causes for increase in the peak pressure. It can maybe help us in identifying the cause, but not inserting all these tubes and all that. Let me show you some more examples. I hope people are understanding what I'm trying to tell. There are so many areas where you need to do a lot of procedures and all that. So, and next, if you see giving anesthesia for children, and understanding the tension that parents would go, and all those things only I think humans can understand, because if you do even a slightest error when you're administering anesthesia, it can lead to gross problems, okay, and people can lose lives. So empathy and the component of compassion and judgment, decision making, all that AI can only guide you, but it cannot physically be there and do all these things. If somebody is thinking that totally you can replace, there is no way I think so. This is what I'm trying to tell. Only this much I can show. And if you want one more example, I can give. Okay, and then, yeah. So this one I would like to show. These are called as target control infusion pumps. So these maybe can be run by AI. Okay, but once to connect this to patient, you need to secure an IV access. So that again needs some level of skill. I'm not telling IV access is the extreme level skilled procedure, but sometimes it will get tricky because some patients would be difficult. So even that part should be done by a doctor or a trained nurse or somebody. And then after that, the machines can actually do the calculations and all that. So that is the thing. So this is about, different areas. What I would like to show you is, see, what I'm trying to tell is some people are commenting 95% can be replaced by AI and all that. There are so many procedures there. There are so many things involved. It is not so easy. What I'm trying to tell is, see, I actually explained in this video where AI can be used, where AI cannot be used. Understanding that is very important. So this applies to many fields. It cannot replace pilots, soldiers, and whoever is directly involved in doing procedures on, hands-on manual dexterity requirement, decision making, complex activities, and then high stakes procedures like medical procedures, and all these things cannot be replaced by AI. It can maybe help them in getting things better, okay, and taking decisions better. So this is what I feel is my personal opinion about AI replacing doctors. And then I think hope Elon Musk watches this particular video, and then I think they will understand better so that they also make things better. I think they should come and work with us to design more AI products which can help us in giving better care to the patient. Thank you very much.